Welcome to a special program here in the WTVP studio. I'm H. Wayne Wilson, and we're going to be talking about mental health pre-COVID and now that we're into the midst of the COVID pandemic. But mental health is the focus of this special program here on WTVP. 20% of U.S. adults face some sort of mental health issue in any given year. However, during COVID, that number has more than doubled to about 45% of adults. Think about that. Nearly half of us are facing some sort of mental health issue in any given year. And that could be as simple as stress. And I think a lot of us know what that can mean to our family. Also, in a study from Wake Forest University in North Carolina, those with mental health disorders are 5 times more likely to have a drug addiction or an alcohol addiction. So the problem is immense, and we are fortunate enough to have 4 people who can talk to us about solutions and identifying how we go about addressing mental health in Central Illinois. Let me first introduce to you from FamilyCore, a clinician at FamilyCore. That's basically a licensed clinical social worker.
Mm-hmm. Yes.
And Sharon Monier, thank you so much for joining
Thank you.
us. Also here is Dr. Ted Bender. He's president of UnityPlace. Dr. Bender, thank you for being on the show again.
My pleasure.
And also with us is Cheryl Crowe. She's vice president of behavioral health at OSF Healthcare. Thank you for joining us.
Thank you.
And Derrick Booth, a repeat appearance from Derrick. He is the director of social emotional learning for Peoria Public Schools. Thank you all 4 for being here.
Thank you.
And I think the first thing we need to do is first, I said UnityPlace, and just for descriptive purposes, could you define what UnityPlace is? It's relatively new.
Yes, and thank you for asking. So UnityPlace is the merger of 3 storied franchises here in Central Illinois. It's the joining of UnityPoint's behavioral health units, Human Service Center, and Tazwood Center for Wellness. And we've been formally together for about a year now.
And likewise, FamilyCore, actually that's within the last several years, a new name.
Right.
And a one-sentence description of FamilyCore.
Family Service Agency.
And we'll be talking a lot about families coming to FamilyCore to get help. And we might point out that it is 120th anniversary of FamilyCore.
Right. We're really excited about that. And it's nice to keep evolving into meeting current needs, because certainly what was needed 120 years ago is not what we need today.
The Heart of Illinois United Way every 3 years does a community needs assessment. And the assessment most recently, one of the top priorities was mental health services in Central Illinois. So I thought it'd be best to turn to Dr. Bender first and ask, what is mental health?
Well, mental health is any set of symptoms or behaviors that cause problems in your daily life. Once you start to develop symptoms that start to disrupt or disturb your way of life, or cause problems in your family, or cause difficulties for you personally, these symptoms can come together and form a syndrome known as a mental health disorder.
I think many of us, at least several years ago, would have sat down and said, okay, bipolar, schizophrenia, things of that nature. But what are we seeing most often? And these may be things that we didn't think in terms of mental health maybe 30 years ago, but now what's most prevalent?
Right now in the United States, and even before this pandemic, the most common mental health disorders were depression and anxiety. We're still seeing that now, amplified significantly, as you mentioned, but also we're also dealing with trauma and traumatic symptoms and post-traumatic stress disorder. You know, combining all of these different elements and everything that we're dealing with right now with increased isolation, economic downturn, is a perfect toxic combination for an explosion in mental health disorders in this country.
Let me turn to Cheryl and ask about, he mentioned trauma, but there are other types of what brings mental health on, not just trauma. It could be seasonal.
It could be. We see, different experiences that you have, different losses that you are trying to survive. In this environment now with COVID, the financial situations, the fear, the social isolation, all of those things impact our ability to cope on a day-to-day basis, and those are key factors for us. And that's what we're experiencing right now, and we're seeing the acuity level of people with mental health issues increasing in all of our environments, whether it's inpatient, outpatient, hospital, wherever you come for treatment, because this has been a prolonged issue now too, and so that's adding to our struggle.
And during this time of the COVID pandemic, the issue is magnified, may I say, and so have you seen an increase not only in people coming to FamilyCore, but those, a broad perspective, maybe multiple family members?
Oh, for sure. We definitely are seeing multiple family members in multiple families. And it's because, their own support systems are being strained and stretched further than normal. Families that already had stress prior to this, families that had a lot of chronic stress, are experiencing more than ever. We didn't even factor in, there's been a lot of community violence across multiple communities in our country. And I think that's created another layer of anxiety for people. And so we have a lot of families who have dealt with quite a bit of loss. And so if you have a significant family loss, that's going to affect everybody in the family. And if we have some people whose resilience is not very, very high, it's a very difficult time to build those factors for resilience. Better those be in place. And so that's why chronic work with people can really strengthen systems and schools to really build that resilience.
Sharon mentioned the issue of violence, but abuse. What are we seeing in terms of abuse?
We don't know exactly some of the factors related to abuse. We were talking before about the issue with children being at home and not going to school and not being out in environments in a public place, so we don't know exactly what's happening. I can tell you for OSF, our Strive Trauma Recovery Center is seeing those individuals who have been stretched beyond their typical coping factors now, and we're seeing more of them come in for treatment because they need that support, they need that counseling, they need that touch base on how to be healthy again.
And Derrick, you deal with students every single day,
Yeah.
and teachers see abuse or signs of abuse.
Sure.
That's changed now with remote learning.
It has. A lot of the referrals to the different mental health agencies and partnerships that Peoria Public School works with, those referrals have decreased. And it's because that face-to-face contact that our staff has with students on a daily basis has declined due to just COVID and being on a remote learning basis. And so it's tough for us to identify students that are in need of supports, in need of services, or even identify that have been exposed or victims of abuse as well.
Are you seeing more situations when you start to look at families who present themselves to FamilyCore? Is abuse part of that issue?
It definitely has its place in there. I would say we've had a lot of families come to us with a lot of anxiety and depression and concern about their children. And I think what we've identified is a lot of what Mr. Booth was just saying, these things are still coming, and because we're back in school systems. I mean, those systems are going to start being a watchdog of a different type of being able to have access in the classroom. So as those things come up, we may see even more of that coming to us. But we have had an increase across the board in almost every program.
The two terms I'm hearing most already in this conversation, anxiety and depression. Dr. Bender, how do you, if you are a family member and someone else in your family might be displaying different actions, how do you know it's anxiety or stress or something else that might warrant going to FamilyCore, for instance, or going to OSF?
Usually what I tell families is if you have a friend or a loved one who has exhibited some significant changes in behavior, whether that's increased isolation, sleeplessness, increased agitation, anxiety, it can be as serious and as open as talking about wanting to die or talking about death a lot. If you're noticing some of these types of signs and symptoms, it's okay to talk to that person about how they're doing, how they're feeling, And if you're really concerned, you can reach out for help. 211 is a great resource. If it gets to an emergency situation, 911 is always an option. But if you're concerned about a family or friend and you don't know who to call, there's lots of resources out there that can help, including UnityPlace and other national hotlines.
As a matter of fact, you mentioned 211, so we actually have a slate popped up for 211, so to remind you that you can access 211 just by dialing those 3 numbers, or you can go to the website. It is not just for mental health issues. 211 can be for a variety of issues, paying the rent, utility bills, hunger. And mentioning hunger, Derrick, that has to be one of the top problems that you faced this past spring and again here in the fall. Even though you're remote, some of the classes are coming back on a hybrid method, but hunger has to be one of the issues that's causing problems within families.
Yeah, when we first went to shelter in place as a community, in addition to making sure all of our 13,000 students had access to laptops and wireless Wi-Fi, the priority for us to make sure our students were fed, they were getting their basic needs met. And today, Peoria Public Schools has served over 560,000 meals to our students just to get those basic meals. One of the services at the Wraparound Center is a food pantry. And when we went to shelter in place, the shelves on the grocery stores were empty. So families relied on the food pantry to meet their needs during that shelter in place time period. And so we've seen an increase in just the magnified number of families that need those basic needs met as well.
Doctor, I want to talk a little bit about some more of those signs. And you talked about signs that were kind of obvious, a change in routine, et cetera. But one that struck me was lack of hope. Can you recognize lack of hope in a family member or a close friend?
It's really hard. If someone is open and willing to talk about how they feel, yeah, maybe. But a lot of times you can be sitting right next to someone suffering from major depression and not even know it. People can be very good at hiding these types of illnesses. We're all kind of feeling a bit hopeless these days. So I think that that's a more common trait now than it's ever been. But when that hopelessness starts turning into, again, changes in behavior, that's the best thing we can look for if we're concerned about friends or family members. You won't always see it, but a lot of times if people are really struggling or kind of tipping that balance scale from kind of pre-mental health disorder to diagnosable condition, you're going to see some changes in behavior, and there are some things you can notice when that's occurring.
Is there a fear of going to an agency, FamilyCore, and saying, I think my uncle is having a problem? What can you say to encourage people to step forward? Because I may not even, I may be wrong. He's just having a bad day or a bad week. Mm-hmm.
Well, we would really want to address whatever barrier they're feeling about helping that uncle. Is he fearful of coming in? What would that be about? Is this, something that's new territory in their family and they don't often speak openly about mental health needs or social emotional needs? And so just to work with them to normalize their experience and to say everyone is experiencing a lot of stress right now and change and uncertainty.
Well, isn't that one of the problems, and Sharon and then Cheryl both, but we don't talk about mental health in our family. We just don't.
We don't. We don't talk a lot about that. A lot of families don't talk about feelings. Mm-hmm. And like Dr. Bender said, you may be sitting right next to someone who's experiencing a deep level of depression and you don't necessarily know it.
Because you can't see mental health issues in most cases.
Right. And so you really have to watch for behavioral cues and to have safety in the relationship so we can start talking about things. But that doesn't happen overnight.
Cheryl?
I think that brings up the point of the fact that we need to start that conversation. Everybody needs to become comfortable in having that conversation. How are you doing? What's going on? What's changing for you? What do you need? All of those things are important for us to ask because people don't, we're very, we just keep going and going and going, and all of a sudden we can realize that we're in a problem situation, or a family member is really struggling. And I think it's important to be open and it be okay to report those symptoms and to use resources like 211 and other sources if you find that a family member is struggling.
Dr. Bender was talking about using the uncle as the example, and I think my uncle's, he's got some new issues here. And he's going to know I'm the one who's calling. And we don't talk about this. We're very uncomfortable talking about mental health issues. Some suggestions on how we might, because that's the first step in finding the solution to the issue.
I think one thing to focus on in those types of conversations is to avoid advice giving and turning it back on yourself. Rather, when you're speaking to someone about how they're feeling or what's going on with them, focus more on listening to what they're saying and reflecting back to them what they're saying. This is a type of active listening that is a tremendous skill for anybody to have, but it shows that you're listening to them, it shows you're present in the conversation, and it avoids that kind of unsolicited advice that most people are very turned off on.
Derrick, within Peoria Public Schools, the typical way of identifying some issues is the teacher. The teacher knows his or her students very well. They don't have that opportunity now. Is there a way through remote learning that they can still identify some of these issues, or is that really where we have a problem?
Yeah, so there's some ways still. There's still that interaction with the student, and you'll be surprised, even some of our younger students, what they will still share in a Microsoft Teams or Zoom type of setting to the teacher. But there's also those times that we've been finding recently where that camera and that microphone is on. So sometimes there's that element of sometimes our teachers are closer to the house than they've ever been before, and they can hear some of the things going on in the background and see some of the things going on in the background. And so we've gotten referrals because of that. So it's a different type of insight and feedback that we get, but it's nothing like that face-to-face interaction, seeing the child, knowing the child, and seeing the child interact differently in the classroom.
We've mentioned UnityPlace as a location to turn to, and FamilyCore, but I wanted to ask Cheryl about OSF Strive. There's a program that you have in place to help families.
Right. And the program was targeting at the very beginning really victims of crime and violence in our community, because there's such a great need, and those individuals may not always reach out for those resources. And so our program was put in place in order to provide those services free of charge to people that need it. They can come in, they can get telepsychiatry, they can get counseling, they can get support services. Some of our people go to the wraparound center, and they go to the schools, and they know that this issue, the stress is on everybody, both the parents and the children. So they want to serve as a source of support and be part of the community, and serve that community with the greatest care and love. That's our goal.
We've talked about already the hesitancy of family members coming forward, or a neighbor coming forward and saying, gee whiz, I think. Once they make that decision, and let's say they call FamilyCore, for instance, how do you approach them? Because they're hesitant to begin with. What do you offer up?
Well, if we have that opportunity for that initial outreach call from them, or we have some reason to have our first communication with them, we work really hard to engage them, to make them feel like this is an okay place to come and get some help. And so just from the front of the first phone call, we just really want to help them know we're holding with them what they're feeling, and we schedule them as quickly as we can so that there's rapid follow-up and an offer made to either come on in or meet with us through video or phone call, whatever works. We've had a lot greater engagement with many, many people because of having the opportunity to have a telehealth session, which we weren't even doing a year ago. We weren't recommending that.
And the family member may be concerned that they might be judged, that their family might be judged.
No, stigma is everywhere, and we work really hard to understand what someone's feeling and to try to reduce any sense that, I would hope someone coming to us would not feel that we are at any level adding to the stigmatization they may feel about that, but rather to just normalize the experience. You know, the range of mental health and mental health needs is so broad that right off the bat we often have to help people understand, oh, this is manageable. What I'm seeing in my father is manageable. We can work, you know, to support him, or to see if there's medication compliance or whatever might be going on for them that may be a change.
Dr. Bender, you want to add?
Yeah, I think that if anything good comes out of this mess is that I'm hoping that stigma is reduced. When we're seeing such significant rises in mental health disorders across the board, across this country, we're getting to a point where you're much more likely to be affected by it with either yourself or a very close relative than not. We're already seeing that with substance use disorders. The vast majority of people now have a friend or a family member suffering from a severe substance use disorder or in recovery. And it's the same thing is happening with mental health disorders. You're much more likely to know someone, be suffering from yourself, or have a close friend or loved one suffering from a mental health disorder. And what we have to remember and what we have to push every chance we get is that mental health is health. It's just as important as taking care of your diabetes or going to the doctor when you have the flu or any other medical condition. It's just as impactful, it's just as deadly, and it's just as important to get treated efficiently and effectively as quickly as possible.
And the U.S. Department of Health and Human Services did a study and showed that 55%, more than half of the counties in America, all of them rural in nature, do not have a single practicing psychiatrist, no psychologists, no social workers.
Yeah, you know, I can tell you at UnityPlace, the demand for mental health services is through the roof right now. In fact, we are constantly and feverishly hiring just to try to keep up with demand for services. And psychiatric availability, psychiatrists and APNs that specialize in psychiatry were in great need before all of this began and are going to continue to rise. At UnityPlace, we have a fantastic relationship with the University of Illinois College of Medicine, and we have a psychiatric residency program operating within our hospital system. And we have new students coming every year, and we work really hard to try to retain and recruit them to stay here in the area.
And Derrick, that rural situation also affects in District 150, Peoria Public Schools, primarily urban. But you talk to your counterparts in the rural areas, and that is impacted there too as well.
Absolutely. Just being on different conference calls and webinars with individuals from across the country, the rural areas get a double whammy. Not only do they have the access to the services, but they have also issues with the internet access and the social media access and the Wi-Fi access. And so the level of care, even virtually, they're not able to get all the time.
In the couple of minutes we have remaining, I want to ask a tough question, all four of you. Is there a way to prevent mental health? And let me start with you, Cheryl.
I think that what we need to do is continue to, can you prevent it? We want to encourage mental health, definitely. We have to be able to address it. We have to be able to talk about it, to recognize it, to really support it in each other, and to make it okay to have that conversation. Just like Dr. Bender said, this is health.
Yeah.
That you can't take the brain out of the equation here. It's part of us being a healthy being and a healthy person and functioning effectively in our community. So we need to address those needs.
So recognition is step one.
It really is.
And I'll turn to you. And how do we prevent mental health? And that's a challenge that
It is a
we're not
challenge.
going to reach in the near future. But
Right. Well, you know, to understand that the key, the element that it is part of health, and to start, with the stronger the family unit, the greater the capacity to meet their needs, and so that becomes a pretty healthy cycle whenever we can, help to deliver that for families, to help them use their own skills for greater wellness.
And family unit, Derrick, that's critical to the learning process. Sure. And I want you to expand on what she just said.
Yeah, what goes on in the home is very critical and goes hand in hand with what goes along in the classroom. So identifying those issues at an early age is one of the things that we try to focus on with Peoria Public Schools. And when we learn about a student's exposure to traumatic incidents or issues or abuse or violence, treating that, start talking to them about that and helping them cope with that at an early age. We do that to try to prevent some of those long-term effects that exposure to trauma or other mental health issues can cause.
Dr. Bender, same question. Is there hope to prevent mental illness sometime in the future?
Absolutely. I mean, in my history of seeing patients, if I had a magic wand, three things I would cure in a patient is good sleep, good diet and exercise. Those three things. And in this time, we have gotten to a point where we are living in a new normal. The Marines say it best: improvise, adapt, and overcome. We're in an era now where we have to do that. We have to prioritize self-care. We have to get exercise. We have to eat right. We have to prioritize our sleep, because we know that COVID-19 is much more deadly with people that have comorbid health conditions, obesity being one of the big ones. And that was been a problem in the United States long before COVID-19 came around.
And with that, we hope you continue the conversation at home, because it's something that we all need to discuss. Let me say thank you to all four of my guests. First, let me say thank you to Sharon Monier of FamilyCore, Cheryl Crowe of the Behavioral Health at OSF Healthcare, to Dr. Ted Bender, President at UnityPlace, and to Derrick Booth, Social Emotional Learning Director at Peoria Public Schools. Thank you to all four of you. And I do want to mention right now that because it is the 120th anniversary of FamilyCore, we want to say happy anniversary, and you can reach FamilyCore through their website at familycore.org or their phone number 309-676-2400. Thank you for joining us on this special program here, and we say thank you to you for taking a step toward preventing mental health issues in the future.